On this video, this is an adaptation of the drawing I just did on probiotics, where we have, when you take a probiotic, you house the good bacteria, the good microbiome down in the colon, lower part of the small intestine. I want to go into pHs because I get this question all the time. What pH should the body be at? Should it be acidic? Should it be alkaline? Should I drink alkaline water? Well, every different part of the body has different pHs. So when we look at the gut first, the stomach pH should be 1 to 2. Just 1 to 2, very acidic, because 14 to 7 is alkaline, 7 is neutral, 7 to 0 is acid. So we're way down here for the stomach, 1.2. Now when we look at the stomach, 30 to 60 minutes, food should be in the upper stomach, 1 to 3 hours, and the lower stomach comes out into the pylorus, which is 7.2. So big variation in pHs. If this pH is too high, the food doesn't digest well, does not want to go into this, and we're creating indigestion. It stays here 30 to 60 minutes, comes to the small intestine. This pH is 6.5. So now this is going to be a variation as you go down. The small intestine is long, so it's not going to be the same, but these are just kind of averages. Down in the colon, 6.5, but that can range from 4 to almost 7. So this colon should be acidic. And that's what helps with this microbiome. And we talked about that on the last video. So it should be, but there can be a range there, but it needs to be acidic. Now the food spends here in the small intestine 1 to 5 hours, and 10 hours to possibly, if you're not doing too well in digestion, could be 10 hours to days in the colon, in the lower intestine. So, but when we look at these other pHs, look at this. Some are alkaline, some are acid. And people say, what about that alkaline water? Well, you drink it, this is supposed to be acidic. So no, you don't want to drink alkaline water. That's just a fad that's come along, which hurts the gut. Will you feel better temporarily? Yeah, just like when you take synthetic chemical vitamins. You'll feel better temporarily, but you'll hurt your health because this should be acidic. So when you look at saliva, it's neutral. The blood and pancreas, bile, those are alkaline. Skin is acidic. Vaginal tract's acidic. Urine is 6.4 to 6.8. I take about, 4 to 10 urinalysis a day probably. And we look for this sweet spot, 6.4 to 6.8. And people will lose weight better if we can get that pH there, which is what we do. Prostate, we're down to 5. Acidic again. Semen, 7.2, a little alkaline. Cerebrospinal fluid, which is a fluid going through your spine, 7.4. Alkaline synovial fluid, that's 6.8. So as you can see, all these pHs are different. But what we do need to know, we don't want to take alkaline water. We want this acidic, and then we want the body to do its thing. So those are the pHs of the body, at least most of them. And so when you think of that, when you think somebody says we need to be acidic, this needs to be alkaline, no, all the pHs are different going in the body. And that's how the body works, and that's how the body works efficiently.